Hi everyone, welcome to Get Well with Dr. Shel. I am Dr. Drshelenalaljiesthetics, better known as Dr. Shel, and I know as a board-certified OBGYN and a functional medicine expert, your health is unique and deeply personal. It is a combination of genetics, lifestyle, and environment. Know this, no matter what your starting point is, you are never powerless over your health. Being on a health journey is a marathon, not a sprint. This podcast is about walking you through many different perspectives on health conditions, symptoms, and solutions that can help you get from fatigued to fabulous. My mission has always been to offer my patients and community the best of mental, physical, and spiritual wellness. You can learn more about me and my wellness center and schedule your telehealth appointment at drshel.com. We can support you no matter where you are in the world. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin. Today, we've got a wonderful, wonderful speaker for you in the Get Well with Dr. Shel podcast. My guest today is a nationally acclaimed innovator and an expert in the field of integrative women's health and reproductive health, sometimes called the Pelvic Guru, Dr. Jessica Drummond. Dr. Drummond is the CEO and the founder of the Integrative Women's Health Institute and the author of a brand new book on women's health, Outsmart Endometriosis. She holds licenses in physical therapy and clinical nutrition and is a board-certified health coach and has 20 years of experience working with women with chronic pelvic pain, facilitates educational programs for women's health professionals in more than 60 countries globally. And she leads virtual wellness programs for people with endometriosis and pelvic pain. Welcome, Jessica. Dr. Drummond, nice to have you here with us.
Thanks so much. Thanks so much for having me. Yeah, and I would say I'm among many wonderful pelvic gurus around the world. My friend, one of my colleagues actually goes by that moniker on, social media, which is really cute. And I think there are a number of wonderful professionals in this field focused on helping women with endometriosis, which we'll talk about today. Yeah.
I definitely need that. I mean, you and I both know, since we both deal with women's health, I mean, being a board certified OB-GYN, I feel like, we have so many women, millions and millions of women who deal with pain, endometriosis, infertility, other women's health issues that are just so devastating when you're going through it. And I think the biggest and the most devastating part is when we can't find answers, right? We just be able to be there for them as practitioners, to be able to be their advocates and their guides. So Dr. Drummond, tell us a little bit about your background so that everybody gets to know you a little bit. How did you go into integrative medicine, and why did you decide to focus on working with people with endometriosis and pelvic pain specifically?
Yeah, so I started my career in physical therapy just over 20 years ago, and I started in orthopedic and sports medicine, but I pretty quickly specialized in women's health, which is really in physical therapy, a focus on the musculoskeletal system, the muscles, the joints, the bones in and around the pelvis, the abdomen. And because it connects to everything, we start with the feet and the ribs and all of that. So what I was doing clinically is working with a lot of pregnant and postpartum women and women with pelvic pain. And then after the birth of my oldest daughter, which was 17 years ago now, I had a bit of a hormone crash on my own. And so I learned a lot from that personal experience about how really taking a different approach to stress, to nutrition, to exercise, being mindful of not over-exercising, really what we now call functional medicine, functional nutrition, helped my patients with chronic pelvic pain, because at the time, the most challenging cases, often we had not a lot of tools. It was a lot of opioids and nerve stimulators, very not actually super effective tools, but tools that were the only thing we had and were addictive and problematic and had a lot of side effects. So I began to, in addition to physical therapy, I eventually went back to school, got a doctorate in clinical nutrition, and began to integrate all of that together. And I realized that with complex pelvic pain, we have to take a system by system approach. It's not just one thing, it's nervous system, it's digestive system, it's musculoskeletal system, it's immune system. And because the pelvic bowl houses, our digestive tract, our reproductive organs, and all of these muscles, joints, nerves, fascia, there were a lot of layers to helping women get real root cause relief instead of just patching it with, really harsh pain medications.
Right, right. And in the long run, that doesn't do the trick because we haven't gotten to the root cause.
Right.
And I think by now our listeners know that, they're here because they want the root cause approach, right? I mean, patients that you see, patients that I see, they want something different. They don't want a Band-Aid approach. They don't want a patch it up approach. They want to know what's causing all this pain, what's causing the symptoms of my endometriosis, and what can I truly do about it for long-term benefit rather than let's just, fix it and move on. And there's no such thing, unfortunately.
Yeah, I mean, I wish there was a magic wand, but unfortunately there's not. So the good thing about that, though, is when you take this approach, it's not just pain relief.
Right.
We get relief with mood symptoms resolve, sleep improves, fertility is preserved or improved, sexual health, mental health. There are so many layers when we get to the root that, energy, people with endometriosis really struggle with deep fatigue. And when we don't just try to kind of whack-a-mole symptom by symptom, instead we optimize all of these different physiologic systems that I was mentioning, generally starting with nervous and digestive systems, many of these other symptoms begin to resolve, which is, it gives people their lives back, really.
Exactly. So, what may start as pain, because pain might be that trigger that brings you into a specialist, but then you end up with an entirely different approach on life. So there are people out there that may or may not have heard of endometriosis or don't really know much about it. So
Yeah.
perhaps let's talk about the symptoms of endometriosis, because so many people might have this condition and perhaps they don't even know it, right?
Yeah.
And, how does it differentiate from general pelvic pain or painful menstruation, infertility? So let's talk about that umbrella a little bit.
Yeah, so the symptoms generally begin while this is a condition that has sort of three probable underlying components. There's still some debate about it in the literature, but there's definitely some kind of genetic or familial component. So in essence, you're born with this condition, but it's also overlain with as an inflammatory condition, and autoimmunity is suspected as a piece of the puzzle. There's a lot of overlap with other autoimmune conditions. And the symptoms tend to activate around puberty or pre-puberty. So anywhere from about 8 to 13 years old is when some of those initial symptoms can happen. And it's tricky because a lot of times that is digestive symptoms, chronic bloating, and the pelvic pain related to endometriosis in the tween and teen years is not necessarily cyclic with the cycle. But the number one cause for teenage girls and, just preteen girls to miss school is pelvic and period pain. So if the pain is so bad that it's keeping girls out of school, if there's a chronic kind of digestive component that hasn't been addressed, something like, it's just maybe called IBS or something like that, haven't found the root cause. And especially if there's some kind of family history where, again, they might not know they had endometriosis, but there was period pain, pelvic pain, sexual pain, infertility, those kinds of things whispered in the history. All the women in our family have bad periods. Welcome to the club. Yeah. That's when my, index of suspicion is even higher.
Right, right. So in addition to the pain in endometriosis, what are some of the other things that, somebody can see, and how is it usually diagnosed? So, we talked about fatigue, we talked about mood swings, we talked about hormonal imbalance causing a lot of these things. Let's talk about perhaps the different symptoms that one can look at and say, you know what, maybe I have endometriosis, and then what are the next steps they need to take for that?
Yeah, so the checklist of common things would be pelvic or period pain,
Mhm.
painful sex, sometimes bladder symptoms or vulvovaginal symptoms. So chronic yeast, painful sex from a vulvovaginal standpoint, other chronic bladder infections or vaginal infections. Um, as I said, pelvic period pain, mental health challenges like anxiety is very common. I see anxiety clinically more often than depression, but depression is possible, especially because it takes often 6 to 12 years to diagnose this condition. So there's a lot of underlying medical trauma. There's a lot of trauma in general in this population. Digestive issues are huge. Bloating, there's literally a term called endobelly, which clinically is generally really a dysbiosis or a SIBO, which is overgrowth of bacteria in the small intestine or an imbalance of bacteria in the large intestine. So, constipation, IBS, those kinds of digestive issues, along with fatigue, sleep disturbances, anxiety. And once you kind of are looking at that checklist and seeing any number of those things, especially if in the history there's some possible family history, even if it was undiagnosed, the next step is to, well, first of all, there's a lot we can do from the clinical nutrition standpoint to just quiet the symptoms.
Right.
So unfortunately, the only way to diagnose endometriosis is via a skilled laparoscopic surgery. And you want to have that done by a person who does nothing but endometriosis surgery day in and day out. They should be a specialist. But before you even get there, it can take a while to find the right surgeon. But I absolutely recommend doing that relatively early. At least do a consultation. You may not jump right to surgery. Surgery is not appropriate for everyone, but the earlier it's considered,
Right.
the more likely it can be fertility preserving. And then in the meantime, as I go through in the book, there are so many strategies that we have to quiet the nervous system, to improve that digestive function, to calm the inflammation. And that can be done either on preparation for surgical assessment and treatment, or even if you never have surgery and may never need surgery, this approach can be effective. And we almost always do this in combination with pelvic physical therapy. So having an assessment with a pelvic physical therapist who sees a lot of endometriosis, again, you want someone who really has a lot of experience, is really important.
Yeah. And I think it's important to realize how common this is. One in
Yes.
10 women between the ages of 15 and 49 have endometriosis. That's
Yes.
176 million women worldwide. I mean, those are astronomical numbers of women who are suffering, and a lot of them are suffering in silence because they don't know what it is. And I can tell you, when I was, practicing traditional OB/GYN and operating and things of that nature, I would see women from teens, preteens, all the way to menopause, and they never really knew what was going on, except they were just suffering. Either they had just started suffering, missing school, and didn't know what was wrong, and that, like you said, causes depression, anxiety, and other types of issues, all the way to menopause, where they've gone through their entire, life not knowing that, hey, it's not in my head, right?
Yes.
Yeah. And to me, that just makes me so sad, because if we just have more information about it, which is why we're doing this interview, then more women can seek the right kind of help and know that there are options. You're absolutely right that the definitive diagnosis, the definitive diagnostic measuring tool is surgery,
Mm.
laparoscopy. And what's interesting is, looking at the actual surgeries myself, because I've done plenty of these, it's interesting because the amount of pelvic pain and symptoms don't always correlate with the stage of endometriosis that you see surgically speaking, right?
Very true. Very true. Yeah.
Right. So interestingly enough, even in traditional OB/GYN, we're like, well, it looked like you just had a tiny bit of endometriosis on the right ovary, but they have just 10 out of 10 pain. Or their entire belly could be filled with scarring from endometriosis, and they might have pain like 2 or 3 out of 10.
Yeah.
Uh, so what you say makes a lot of sense is it's not just the amount of endometrial tissue that might be on different areas of the pelvis, because that's exactly what it is. It's the tissue
Yeah.
that should be inside the uterus that has kind of escaped, and it's in different areas of our pelvis, whether it be on the bladder or the bowel or the uterus or the ovaries or fallopian tubes. So it's really, really an interesting thing because it is a multifactorial thing, right?
Right. And there's a lot of myths, right? That pregnancy cures endometriosis or menopause cures endometriosis or, but that's not true. We really, it's a whole disease process. And in fact, after excision surgery, where the lesions are actually taken out, we see a drop in autoimmune markers. So that's why taking this more functional nutrition, functional medicine approach is so useful, because we can deal with the chronic inflammation piece. We can deal with the autoimmune piece. A nervous system is huge. I'm always telling my patients, no matter what the food plan is, because, obviously we're moving in the direction of a more anti-inflammatory food plan, but a lot of these patients also struggle with eating disorder because of the history of bloating and digestive symptoms. We don't have to be excruciatingly strict. What we have to do is calm the nervous system, because if, we can't eat when we're in and absorb when we're in fight or flight, right? Fight or flight is opposite of rest and digest. So that's a really important piece that I think a lot of people don't think of when they're, searching for the endo diet. There's not one diet. It's a whole system of getting the nervous system and the endocrine system and the immune system online and functioning well. Yeah.
You're absolutely right. I want to kind of focus a little bit on your book and want to kind of discuss what's in the book and your new book that we're so excited about, and tell us what's new about the approach, the overall approach that you talk about to endometriosis from start to finish in the book.
Yeah, so we have a digital clinic. I now have about 7 health coaches and another naturopath, clinical nutritionist who works with me, and we work with patients all over the world. So this book is really about that whole process that we take. How we look at each system, how we try to fine tune the food plan to personalize it to each person. We include anti-inflammatory recipes. We talk about when to be more strict, when to not worry about being as strict. We talk about how to find a skilled excision surgeon. We talk about the other members of the team, like the physical therapists and the psychosocial support that can be really valuable, to consider the history of trauma. And so the way that we take this multidisciplinary approach really allows for that complete healing. And I really map out everything we do in our clinic in this book, so people really understand, even if they aren't working with us directly, they help the team that they are working with rest all of the pieces and not just sort of go in, try to cut out the lesions and you're good to go, because that's not generally how it works, unfortunately.
Absolutely. There goes a lot, the whole lifestyle medicine, right? So when you're talking about lifestyle medicine, and I want to kind of focus on the nervous system and the autoimmune system a little bit. When you're focusing on the nervous system, tell our listeners and our viewers a little bit about what kinds of things do you recommend as far as any testing, as well as any treatments, the supplementation, diet. Of course, we talked about the anti-inflammatory diet, but let's talk a little bit about what kinds of testing do you recommend when you're looking at the digestive system, the nervous system, and then the entire autoimmune picture with endometriosis?
Yeah, so we use heart rate variability tracking. We use fitness trackers actually to do that. And we've got a database where we're comparing people to themselves. Are they seeing improvements in that heart rate variability? Is it outside of their range? Is it getting worse, better? Does surgery impact it? All of those kinds of pieces we're looking at. And that's an objective measure of stress, which is how we kind of check in with the nervous system. The other thing we do to check in with the nervous system is we use organic acids testing to look at the neurotransmitter levels. A lot of times you'll see low GABA type anxiety because it's not just kind of an emotional anxiety, but it's really a very physical anxiety, which overlaps with a lot of the pain. Sometimes we do have more low serotonin anxiety as well, but that's really important, looking at which neurotransmitters are low. And then we also do a lot of stool testing to look at the microbiome of the gut. And we sometimes use breath testing to look for SIBO, which is that small intestine bacterial overgrowth. But most of the time we can tell that by symptoms, and we're going to try to address it in almost every case. That's a very common piece of the puzzle.
I'm glad you mentioned that because, I think that a lot of people don't know where to go next, right? Mm-hmm. So in both of our practices, we both agree that, you want to look at data as well, because it's not a one-size-fits-all approach, right? So stool testing, when you do a stool test, when you're looking at the microbiome, it's fascinating information where how much inflammation there is, how much dysbiosis there is, what kind of metabolic imbalances there are. Does this individual need more probiotics, prebiotics, butyrate, betaine? And you can customize the program by using things like pancreatic enzymes, other digestive enzymes, protease and things, proteolytic enzymes and things of that nature. So I think this is something that is great new information for a lot of people. And it's important for them to know that the digestive tract is so related to your pain receptors even, right? I mean, there's so many neurotransmitters in the digestive tract, working in the digestive tract. So
and the gut microbiome talks directly to the brain through the vagus nerve or even through the blood-brain barrier. So we do a lot of vagus nerve toning, and we think about post-op recovery. So a lot of our patients do have surgery, which it can be very appropriate. And like you said, things like proteolytic enzymes can help with that recovery. Things like visceral physical therapy, things like high dose curcumin or fish oil. So we have so many tools that I think are often underutilized, and which really heal the system at a cellular level. We help optimize mitochondrial function post-op and pre-op. So looking at it from that perspective is so important because we really want, root cause healing all the way to the level of the cell and the gut bacteria and the chemical messengers in the brain. And that really helps people feel so much better holistically. It's not just, a pain relieving medication.
Exactly. What HRV, heart rate variability app, do you suggest a certain app to your patients that, some of our listeners can perhaps download?
Yeah, we've used the Garmin Vivo Smart 4. We've tested a few things. Oura Ring is useful because it looks at raw HRV data, but it only looks at it at night. And interestingly, we work with a lot of women who are young college age women or high school, and the Oura Ring's too big. They don't have small enough sizing. But that's a useful tool. So the Garmin we've landed on, it's a little less expensive, and we have a database like a technical system in the background that allows us to check it. But it also comes with its own app and the HRV is not given to us in raw numbers, but it's given to us in a algorithm that's primarily based on HRV called the stress score and the body battery score. So we're looking for when someone wakes up in the morning, for their body battery to be close to 100, that they're able to tolerate some activities, whether fitness activities or, using their brain. And then, so that will drain the battery, but not crash it all the way down. There should be some resilience there. And then we can see at night, are they getting good quality sleep, low stress? And because it tracks stress all day and all night, we can see if things like certain foods are flaring up their stress, or certain times of day are more problematic, or if they're over exercising, or certain relationships are flaring it up. Like, it doesn't lie, and it's on you all the time. So it's really a valuable tool in our practice.
Absolutely. Absolutely. I think, because a lot of patients, a lot of people in general don't know what is feeding the health versus taking away from the health. And, you mentioned certain things like GABA, for example. I think I have, I guess hundreds and hundreds of patients on a really awesome product that I'm sure you've heard of called Neurocom with GABA and L-theanine, an amazing product to take at night. But it really brings that sympathetic tone down, because we all want to exist as much as possible in the parasympathetic state. And for the listeners, that's more of the calming, healing state where you're not going to feel so stressed. So we definitely know there's a huge connection between stress and triggers of the pain.
Yes, for sure. And so that's a nice way for women to really learn what their own triggers are. And then, as you said, we have lots of tools. We have mindfulness strategies. We can change the stressors in some cases, not always. Sometimes the stressors are going to remain, but if they're going to remain, then we use other tools, whether it's, supplements, changing the food plan, teas. I mean, there's all kinds of things we can do. So
absolutely. So what happens to women when, there are women who either A, don't know they have endometriosis, or B, they have it and it doesn't get treated? What happens when you leave endometriosis untreated?
Yeah, it's the biggest problem. Well, first of all, the symptoms are often not going to resolve, but it's also a significant fertility risk, which is why I recommend that people do surgical consultation early on, even if they end up choosing not to have surgery, or if surgery is not the right option for them. It's important to just be aware of your choices, because long-term it can impact fertility, and because it's not cured by menopause, these symptoms can last a lifetime unnecessarily. So we do want to address the disease itself, and these lesions, even if we optimize all of those systems and we get hormone balance, from a blood standpoint, the lesions themselves can actually produce hormones that sustain them. And so it is a disease process that is important to really, it's very important to know if that's what we're dealing with, because there are certainly other conditions that present with pelvic pain and digestive issues that are not endometriosis. So, it's helpful to have a true diagnosis at some point.
Yeah, for sure. I want to kind of focus on endometriosis and hormonal health and hormonal balance. So, we talk a lot about estrogen dominance, right? Talk a lot about the traditional approach for decades now is you do a laparoscopy, you do Lupron before, after, what have you, birth control pills. So tell me what research is out there on the functional medicine side about agents such as birth control pills that, gosh, millions and millions of teens are on for a variety of reasons, whether, oh, my period's too heavy, or my period's too painful, I'm having to miss school, college, what have you. What do you tell your young patients about taking birth control pills for improving their symptoms?
Yeah, so it can be a valuable tool in the whole treatment plan of endometriosis. So let's say someone figures out that they have endometriosis at age 14, they have a family history, it's a very likely, highly likely case, and their period pain is so bothersome that it's keeping them from going to school, from going to sports, anything like that. And they're, it's very disruptive to their lives. And in some cases, although not all, because endometriosis lesions we learned back in 2018 are not all estrogen driven for sure. But let's say taking birth control does suppress estrogen enough that it's pain reducing so that someone can live their life. I'm not necessarily against that as a short-term tool, and even post-surgically, again, as a short-term tool. And especially if someone is looking to use birth control to delay pregnancy, that's fine. But it doesn't fix the problem. And if we do that without really acknowledging what the problem is, we suppress the symptoms sometimes without really addressing those root cause systemic issues. So you still have the digestive issues, you still have the mental health issues, you still have the energy issues, the mitochondrial issues, and you just delay that process. And now you've gone and kind of mucked up their hormones. So, so it has to be used very thoughtfully as a specific tool. And again, especially in teenagers, taking hormonal birth control actually significantly increases the risk of suicide. So it's not a benign thing. It's not M&Ms, you know, well, which aren't really benign either, I guess, but this is, they're much more benign than birth control. Yeah. So, you know, while birth control, hormonal birth control can be a useful tool for endometriosis in particular situations, it's not the solution. It's not a long-term solution, and it's definitely not the cure. And in the worst case, it can cause really devastating side effects or never really understanding what's actually going on. So then when someone tries to get pregnant in their mid-30s, they've missed a huge window of opportunity.
Right. And I think that these are really important points I wanted to bring up because, you know, it's not easy. These are not easy decisions. And, you know, we feel, both of us have daughters. We feel their pain when they come to us and say, oh my God, my period's so heavy, or, oh my God, I'm having so much, menstrual pain, dysmenorrhea. What do you tell your patients that you're consulting with all over the world? What do you tell them when they say my periods are just so heavy, or my period is so painful? And what if they don't have endometriosis, right? But they need some support or help to decrease their amount of menstrual bleeding or their amount of menstrual pain. And all their friends are on a birth control pill. But this person wants to do the functional medicine route, right? What are you going to do for them?
Right. So if someone just has heavy, irregular, painful periods that are not related to an underlying condition, it's really a lack of optimal functioning of those systems, then their situation is, in a sense, easy for us. The challenge is the implementation. So, you know, as a teenager, you aren't going to probably love eating a low inflammatory, you know, gluten-free, dairy-free, low sugar food plan, you know, things like that, adding more vegetables, adding more healthy fats, adding more quality proteins. However, as you said, there are certain girls and women who really do want to embrace this approach, and just shifting the food plan to be more blood sugar balancing, more nutrient dense, and then doing everything we talked about earlier for the digestive tract, calming the nervous system, learning our stress triggers. I mean, what a valuable thing to learn when you're 15, 16, 17 years old, to learn to manage your own stress, to reduce some of the stress that's at all possible. You know, these girls can actually make a huge difference to their long-term health just by bringing that awareness. So we lower the stress, and we help with things like digestive enzymes, betaine, you know, digestive tract function, gut microbiome optimization.
Do you feel like that decreases
all of that.
Their menstrual bleeding? Do you feel like that decreases their actual flow in a lot
Yeah, for sure. Especially if you address the liver, because it comes back to balancing estrogen, right? So blood sugar stability, balancing the cortisol, which is a stress buffering hormone, and then better metabolism of estrogen, which happens both in the liver and in the gut when we're talking about more exogenous estrogen. So less drinking out of plastic water bottles, less endocrine disrupting chemicals. All of that can improve their menstrual flow, make it more regular, less heavy, less cramping, less, big clots. All of that can happen for sure.
Yeah, that's great. And see, that's very, very encouraging to the young population because unfortunately they're surrounded by their peers who are just on pill because it's the easy way out, unfortunately. And so I'm glad we talked about that because I like to give this tool to mothers who are listening for their teen daughters, as well as the young population, the millennials who are listening and just thinking, I don't have time for that because I've got a busy life. So let me just start taking the pill. This is it's more commitment, right? It's more commitment. It's more work. But once you do the work, it becomes a lifestyle change and it actually becomes a very amazing long-term solution to healthy living. So
and this is why we have so many health coaches as a part of our program who are very knowledgeable about pelvic health, because it is a commitment. But if you can commit to it for something in the neighborhood of 3 to 5 months, your whole life trajectory of health can be dramatically improved, and it gets easier and easier. And, quite honestly, in the last 8 months, people are cooking at home. We've got more, healthy delivery services, things like, Daily Harvest and Sunbasket. And there are so many tools now to make this simpler. There are tons of meditation apps, and we can track our own stress. And I find that Gen Z and millennial girls and women really love all these tools. They love taking their health into their own hands. My 17-year-old daughter takes her basal body temperature every morning with a thermometer and an app, So they like having an understanding of their bodies and control over their health, where they don't have to, they're not kind of showing up with no knowledge at all to their gynecologist. And they talk a lot more about like period apps and that sort of thing. It's no longer such a hidden voodoo topic.
I think that, definitely the younger generation is taking their health in their hands much more. They are practicing more mindfulness. I mean, same with my kids. Zoe's 20 now, unbelievable. And Zade is 17, but they both have the Calm app on their, they've got Fitness Pal, they've got the Calm app, they do Down Dog for yoga. They've got all of these in place, and whether they like it or not, and now they've learned to like it. They're on digestive enzymes and probiotics, and have a little old lady pill box with all their supplements. So, I think it's how you start when you're young. But you and I both agree, and so do many of our functional medicine colleagues, that it has to start at a young age, and then they'll just live healthier lives. Thank you for all that wonderful information. If clients would want to work with you and your digital team that specializes in endometriosis and pelvic pain via telehealth, can you tell us how they can find you and how they can work with you?
Yeah, so our website is Integrative womenshealthinstitute.com, and you can find the book right now on Amazon or Target or Barnes & Noble. And just send our support team, support@integrativewomenshealthinstitute.com, your receipts, and we'll send you more information about the program. And you can just look at the program. You can also follow us on Instagram for any questions @Integrative Women's Health.
That's awesome. And just one more time, give the guests the title of your book.
The title of the book is Outsmart Endometriosis.
Awesome. Well, look up Dr. Drummond. She's amazing. I've known her for many, many years, and get a copy of her book. And if you have any more questions about endometriosis, pelvic pain, she's a wealth of knowledge. Dr. Drummond, thank you for your time today. This was a wonderful conversation, and I hope you have a lovely day.
Thanks so much. Thanks for having me.
Absolutely. Bye-bye. Thank you so much for making time for today's podcast with Get Well with Dr. Shel. I know that this conversation and education can help you to create your best life possible on every level. So definitely tune in to hear the newest expert and learn the latest protocols to support your best health journey. You can learn more about me and my wellness center at drshel.com, drshel.com, and I hope that you will make time to come visit us in the Houston area to take a deep dive on self-care. My team and I are completely devoted to helping you live a better life from this moment forward. The best days of your life are ahead of you, I promise. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin.